Hi, risk adjustment innovators, learners, and operators. Welcome again to the Hills Academy Risk Adjustment Made Easy, the Medicare Advantage Kind learning series. This is your host tutor, Dr. Prince Bewa, and we are happy that you joined us today. Last week, we went through some of the definitions of risk adjustment, and today we'll be going through its implication for patients and for providers. So thank you for joining us and welcome as we study together. So understanding risk adjustment implications. So for beneficiaries, we went through last week, we had Mrs. Jones and Mr. Clark. And Mrs. Jones, we learned that Mrs. Jones is 66 years old, female, and has one chronic condition and lives at home, and also had a risk score of 0.8. And because of this, Mrs. Jones' risk score and healthcare cost is less compared to Mr. Clark, who is 74 years old, male, 4 chronic conditions, live at home as well, and has a risk score of 2.5. So learning about the risk score for Mr. Clark, who has a risk score and healthcare costs relatively higher than Mrs. Jones. Now we can learn that as open season comes and Mrs. Jones and Mr. Clark select their health plans, they have 2 different needs. And therefore, as they select health plans, we have open season coming in. They are thinking about themselves, which health plan should I choose? We can recognize that Mrs. Jones can now select health plan A, which will meet her needs, compared to Mr. Clark, who is likely to choose health plan B, which will meet his needs. Mrs. Jones and Mr. Clark has totally different needs, and therefore chooses totally different health plans that will meet their needs. And now, as we turn on to providers, understanding the risk adjustment and the risk score and the risk profile of your beneficiaries help you to better care planning and fair compensation. So as a provider, you want to make sure that you are prioritizing comprehensive and accurate needs assessment, documenting all relevant health conditions to support the care planning and accurate compensation. So there we have it. Risk adjustment isn't just a jumble of words, but by understanding the so what and now what of risk adjustment, beneficiaries can chart their health journeys and providers can steer towards better care. These are some of the implications for providers and also for beneficiaries. And as we discussed last week, we have a cheat sheet that goes with this video, and you can always access it from the Hills Academy website. And I'll go there again from last week. And this is the Medicare Advantage Risk Adjustment Basics. What is risk adjustment? And you can click on this one and it should get you to the cheat sheet that has the implications for providers and also for beneficiaries. So thank you so much for joining us. If you haven't gotten your signature gift, you can always go to the website, to the Hills Academy website, as we have here. And you can download it. It's From Chaos to Clarity, the Essential Medicare Advantage Risk Adjustment Data Sources Comparison cheat sheet. And you can download your copy. And please feel free to like, to subscribe, and to reach out and to share with the link that is below. And thank you so much for joining the Hills Academy Risk Adjustment Made Easy learning series. And we'll catch you next week. Thank you and have a good one. Bye-bye.